Hey everyone, welcome back to another Top 5 Tips from Clinical Physio with me, Khalid Maidan. Today's Top 5 Tips focuses on plantar fasciitis, a condition which is all about increased load being placed on the plantar fascia of the foot. Top tip number 1. Self-management strategies to reduce pain for this condition are plentiful. The UK NICE guidelines for managing this condition highlight the use of medication and ice in particular. In relation to medication, ask your patient to liaise with their doctor for an appropriate prescription for analgesia. In terms of ice, frozen peas covered by a towel should do the trick, but rolling a cold drinks can underneath your foot is also a really good option, which can give several hours of relief. Top tip number 2 is stretches. Gastrocnemius, soleus, and plantar fascia stretches are often a key treatment for patients with plantar fasciitis, as calf tightness is often a feature of this condition. What are your options? Pulling the foot into dorsiflexion with a towel can be done with an extended knee for gastrocnemius, or with a flex knee for soleus. Focus on placing the towel specifically at the toes or metatarsal heads to stretch the plantar fascia. For patients with very irritable symptoms, when they get out of bed, get them to keep a towel by their bedside so they can do this stretch before they get out of bed in the morning. This gastrocnemius stretch against the wall, or off a step like so, are other good ones to perhaps progress to if your patient finds them comfortable. Top tip number 3 is to advise your patients on the use of foot orthotics or insoles. These work really well in offloading the plantar fascia and supporting the longitudinal arch of the foot by reducing pronation. You can refer your patient to a podiatrist for these, but studies have shown that custom-made orthotics are not necessarily superior to prefabricated ones. In the short term, antipronation taping is another really good way of offloading the plantar fascia. Top tip number 4. Check your patient's gluteal strength, particularly the hip extensors, which includes gluteus maximus. During the propulsion phase of gait, your patient will have to do what they can to push themselves off the ground. And if their hip muscles are too weak, guess who gets lumped with all the work? You guessed it, it's often the calf muscles and the plantar fascia. So you may need to strengthen the hip to take the load off the lower leg. And finally, top tip number 5. If you're finding that your patient is not progressing as you may have expected, check their balance with something simple like a single leg stand. If this is poor, they may have associated increased tension in the posterior chain, contributing to their calf tightness and thus stressing the plantar fascia. If they do have poor balance, doing graded gradual balancing exercises, such as throwing and catching a ball with a decreased base of support, may be an easy way to restore some of their balance function and ease the calf and plantar fascia a little more. So that's it from me. Thank you as always for watching, and for more great tips and revision bits, subscribe to our YouTube channel, follow us on social media, and keep watching Clinical Physio.